an assurance that those medical opportunities are going to be there for you. And for the millions of our fellow citizens who, through no fault of their own, but the circumstance of birth, the circumstance of economic circumstance, are today going to get health insurance and coverage in America. Never again will American citizens be denied the opportunity to have the kind of health care they deserve. That's important to all of us. So there are many things that will happen instantaneously in this bill. Doing away with the kind of discrimination that's occurred on the basis of gender and age. No more having arbitrary limits on coverage, new protections against going bankrupt because of health care costs, and no more insurance companies dropping your coverage because you get sick. Now, there are those who advocate the status quo, and I'll be brief on this point, but I think it's very important. Obviously, the individual circumstances that are improved by health care, you're going to hear a great deal about. But there are those who are advocating that we should wait to another day, put this off. It's too controversial. It's too complicated. Well, obviously, the answer to that is a resounding no, but there's a reason why we should say no, beyond the human elements that are so critically important in all of this. If we allow this situation to stagger further, the problem only becomes more difficult and much harder to resolve. None of us want to see premiums double, as they will in the next 7 years, for $12,000 for a family of four to $24,000 if we do nothing. That's the status quo. 3.5 million jobs could be lost in our country. Bankruptcies increase. Foreclosures of homes. The status quo is unacceptable. This Congress, this presidency are going to sign into law a national health care program for all Americans. That's why we're here. We need your support and backing of this.
Good job, Chris. We're going to have more things like that.
Dodd's a hard act to follow. Well, this is truly a historic and pivotal moment in this long march. At long last, we have this strong merge bill with a strong public option to take to the floor of the United States Senate. This last weekend, I was on a little train ride, and when you go on a train ride, you pick up something to read, and there was a book on my credenza that had been there for some time. I really hadn't read it. But I picked it up, took it with me, and I read it. It's a book by Reid. It's called The Good Fight. And it's sort of his life story and all the good fights he'd been in, sticking up for people and underprivileged and fighting for people that didn't have much and trying to advance our country. Well, Harry, you're going to have to get a new edition of this book and add a new chapter, because this is another good fight that you're leading for us here. And I'm sure glad you had that letter from Harry Truman on November the 19th of 1945. I knew that was an important day. That was my 6th birthday. I remember it well. I said at that time, I'm going to be here and I'm going to help carry Harry Truman's dream forward. I said that.
Happy birthday.
6 years of age. But, God.
You don't want us to sing? I'm not going to sing happy birthday.
No, I hope not. But I truly do want to thank Senator Reid for his patience and his great leadership on this. What a great story there is to tell about what he did to bring us to this moment. And also for Chris Dodd, who led our committee during these trying times, keeping in constant contact with Senator Kennedy and getting our help bill through the committee. We couldn't have asked for a better leader, and as you can tell, for a more inspirational leader than Senator Chris Dodd. And to Senator Murray, who we worked with to get our bill through the Help Committee, Senator Schumer, Senator Durbin, always there, all pulling together to get us to this point. So I salute all Democrats and Republicans who helped us get here. But I got to tell you something. This bill, not only is it fully paid for, it actually reduces the deficit. And so now, after all this sort of chaff that's been out there, now we get to the substance of the bill. And on that score, I'm very confident that not only will the Democratic caucus unite around this bill, but the American people will unite around it also. mean, what's not to like? We extend insurance coverage to almost all Americans. 94% will be covered. Provide subsidies for those that can't afford it. It will ban insurance company abuses such as denying people for pre-existing conditions, dropping policyholders who get sick. It helps young people find better coverage, keeps them on their parents' plan until age 26. As I said earlier, it includes a strong public option to give more competition out there. It helps families make more informed decisions on prevention and wellness, and that's something that hasn't gotten a lot of attention, but it's something I've worked very hard on. This bill has a huge thing in there to move us more for prevention and wellness, to keep people healthy in the first place and keep them out of the hospital. No co-pays, no deductibles for certain preventative measures. Well, our aim here is very simple, to recreate America as a wellness society, to get away from sick care to true health care. So again, the way is clear. As I've said before here, we've got this bill. It's all paid for. It covers all Americans, makes health care more affordable, reduces the deficit. Well, I guess as an old-line Democrat, here's what I got to say about that. We had the New Deal, we had the Fair Deal, and this is a good deal for the American people. Thank you.
We believe it's important that you hear from someone who's not an elected official, but someone who's down there that has experience in the real world. Loretta Johnson. Loretta Johnson's 62 years old. She's going to tell us a little bit about some of the problems she's had with health care. Loretta?
Thank you so much, Senator Reid, and I'm honored to be here today. My husband had open heart surgery, was a diabetic, and he had a pacemaker. And when he became so sick in the year 2000, I decided to quit my job and stay home to take care of him. With quitting my job, I lost my health coverage. And after he passed away, I became a health care worker, which means I'm at the bedside taking care of sick people every day, and I do not have health insurance. That is why I'm so proud to be standing here today representing SEIU and its 2.1 million workers. Because after more than 100 years of debate, Senator Reid has said enough. Enough scare tactics and enough politics as usual. So the Senator's Patient Protection and Affordable Care Act puts us one step closer to the health care that every American needs. Because of his leadership, insurance companies will no longer control our health care system, making sure people like me actually have the health care we need. Now, in my opinion, there's probably some room for improvement in this bill, but I know that Senator Reid and all of the senators standing here with me today are committed, as we are, to making sure people can afford the care they need.